Okay, let's see. Question says, a nurse is working in an emergency department and receives a client after a radiological incident. Which task is utmost priority for the nurse to do first? A, decontaminate the client's clothing. B, decontaminate the open wound on the client's thigh. C, decontaminate the examination room the client is placed in. Or D, save the client's vomitus for analysis by the radiation safety staff. In this video, we're going to go over how to answer priority questions when it comes to the NCLEX exam. All right, so let's go over, how to really go through different types of NCLEX questions, specifically priority questions. And what I'm going to do is I'm going to give you some different types of tips that will hopefully help you to see the picture a little bit better when it comes to these type of questions. Now, I will first tell you that there are a variety of different types of priority questions. It's not just only, one type, right? As far as who do you see first, but it's also questions that have to do with delegation as well. It's also really understanding, what's the initial response, what's the first thing you would do, right? So these are all those type of priority questions. And the key is that you have to first grasp the core concept. And once you get the core concept behind what it is, then you'll be able to pick the answer better. Like, you need the foundation and the right information. So going back to that question, before we go into it though, here's a couple of things that you want to write down that will help you to identify how to answer priority questions. One is, hold on, let me pull this here. Okay. All right, the first one, when it comes to priority questions, is first being aware that what point are we in the nursing process? All right, what point are we in the nursing process? So you need to identify that, so when we look at the nursing process, right, starting from assessment, we have diagnosis, planning, implementation, evaluation. So the goal of nursing, nursing is a 24-hour care, right? And the goal is to help to restore the patient back to health. And what you have to understand is not to assume that every answer is assessed, because if you assume that, then that takes away all form of critical thinking, right? You don't really have to think critically if the answer is always assessed, right? So the mistake that a lot of people make is that you make the assumption that it's always assessed, right? It's always assessment, when you have to first stop and evaluate, okay, based on the nursing process, what stage are we in? At what stage are we in, right? Are we in the assessment phase, the diagnosis phase, and then are we in the planning phase, the implementation phase, or the evaluation phase? Excuse me. So once you identify what phase you're in, then you can look at the question and then from there figure out, okay, where we are at in this, based on the scenario, the phase, and then pick the next appropriate answer. Okay, so that's one of the things that will also help you to pick the answer better, is to identifying that phase. And then the other thing too is that you have to think of this more physiologically. So I think what makes people struggle with answering, just questions in general, is that you're focusing too much on being a test taker than being a nurse. Like, you're looking at the question way too much as a test taker than you are as the actually registered nurse or licensed practical nurse. Once you can understand it from the perspective of the nurse, the answers are easier. So, and from there, you have to think about, okay, what is the physiological implication of what the question is saying? So going back to the question, a nurse is working in the ED and receives a client after a radiological incident. Which task is utmost priority for the nurse to do first, right? A, decontaminate the client's clothing. B, decontaminate the open wound on the client's thigh. C, decontaminate the examination room the client is placed in. Or D, save the client's vomitus for analysis for the radiation safety staff. You can put below this video, you can comment right now and tell me what you think the answer is. So for this question and all the choices I just told you, you need to do all of them, right? All of them need to be done, but it's what needs to be done first. And you have to think about what's the physiological impact of exposure of radiation to the skin, right? And so our biggest thing is that when somebody is exposed to radiation or can be exposed to radiation, our main thing is to minimize that exposure as much as possible, right? Because then it can have detrimental effects in the patient's organs, right? It can have detrimental effects in the patient's hemodynamics. So if we think about that, the open wound is the one that has the most direct access to exposure right away, right? So that open wound on their thigh, right, has the most exposure immediately. So we want to minimize that exposure as soon as possible first, because that has the most direct impact to the hemodynamics of the patient's body. So that would be the first one that I would do. Then from there, the clothing will be next. So from inner to outer. So the wound, then their clothing, then the room, and then the vomitus, in that order. So when you can identify, okay, what is the physiological process that I need to understand? What's the concept? The concept of radiation is to always minimize exposure. That's why the standard is they're not supposed to be in the room for more than an hour if they have potential exposure to radiation. Like for example, a nurse, a visitor, right? If they're pregnant, if somebody is pregnant and they come to visit them, we tell them not to visit them, right? Because of exposure. So the wound has the greatest level of exposure because it's closest to it has the greatest amount of risk to enter into the bloodstream and causing more damage. That's why the answer is going to be B. So this is one of the things I would tell you to do, is that you have to think about the physiological impact, the physiological process, right? The concept. You need to also finally address what point are we in the nursing process, right? ADPIE, right? Identify what that is. And then the third thing too is that you gotta definitely know that this is more like delegation questions. You gotta understand, what does the RN do? What does the LPN do? What does the CNA do, right? What separates each personnel from the other? And that will help you to also answer delegation questions. If you feel like you really need, more help with, when it comes to answering questions, thinking more critically, passing the NCLEX, go ahead and go below this video and download my free ebook. The ebook will definitely guide you and give you some reasons what mistakes you may be making. And then I can actually also work with you, right? I can help you to pass your NCLEX exam and give you that coaching, that mentorship that you need. So you can go below this video, either below or down, and schedule a free one-to-one NCLEX strategy session for more help. All right? So thank you so much for watching. Go hit the like, subscribe button, depending on where you're tuning in from. Comment below, share this video with somebody else that could also benefit from this, and I will see you the next time.